Okay, good evening. My name is Heun. I'm a consultant psychiatrist, and today I'd like to continue in our series Mental Health Explained. This series is thought to help people who might have relatives, who might have mental health problems themselves, or who just generally want to learn about mental health problems. Anyway, starting today, I'd like to explain the necessary examinations which are needed to assess a patient with psychosis or schizophrenia. These are people who might hear voices or might be paranoid. And for all these people, it's absolutely necessary that there's this decent medical history and physical examination. And it's very important to look at the different types of psychotic symptoms. But the most important things I'd like to focus on today is on the physical examination. So why do we need a physical examination in psychosis or people with schizophrenia who have hallucinations? The special thing is that the brain is quite simple in a way that everything which can affect the brain can lead to psychotic symptoms. So this might be an infection of the brain, it might be hepatitis, which then can affect the metabolism in the brain. It could be in the elderly a UTI, urinary tract infection, which then can cause psychotic symptoms. So for that reason, that people with psychotic symptoms need a neurological examination. They have to be checked for headaches, head injuries, and then they have to be checked for neurological symptoms such as abnormal movements of the mouth, tongues, of the eyes, double vision, hearing impairment, visual impairment. And it's sometimes very common that people who have visual impairment are more likely to have delusional disorder. Fits, faints, blackouts, dizzy spells are all symptoms which affect the brain in a way that the blood flow to the brain shows that it's not enough, and this is why people fall or faint. Disturbances of consciousness, memory problems, a previous stroke or a current stroke, problems with coordination, tremor, and muscle stiffness can be signs of different types of neurological symptoms. When I started, I was working in the Max Planck Society for Multiple Sclerosis, and even though it wasn't very often that we had patients who were psychotic, there were some patients where the multiple sclerosis was first detected when psychotic features were starting. So everything which affects the blood flow can also affect the brain. That can be cardiovascular problems, chest pain, palpitations, low oxygen levels like respiratory problems, dyspnea, autopnea might be interesting and important. Gastrointestinal symptoms might be of relevance for constipation, nausea, vomiting, and as I said, UTI infections may be important. So sometimes, people have medications and then they might have sexual problems, but that's not really the main focus. That's more rare. So what people need is a mental state examination. So we have talked about the neurological examination to find physical health problems of the body or the brain, which might affect the function of the brain. So the mental health examination goes to assess what I've done in another video, looking for the symptoms of psychosis, hearing voices, disturbed speech, formal thought disorders, but that's a different cup of tea today. So then you have to check for orientation, memory, concentration. Then you have to look whether there's any other severe memory problems. And people with dementia sometimes start having problems with psychotic symptoms. So very often in the elderly, it's psychotic symptoms such as poverty, anxiety of poverty, continuous thinking about financial problems might be a problem. Right, and So one also has to look and find out what's the family history. Is there a family history of mental disorders or family history of psychiatric illnesses? Is there a story of drug abuse or drug abuse from cannabis, for example? Sometimes a history of obstetric complication can indicate some brain damage. Then brain injury, previous brain injury, or severe comorbid medical illnesses such as diabetes or chronic hepatitis might affect the brain and hence might also cause psychotic symptoms. It's also very important to look at the living conditions. What is the knowledge of the disease? Are there any problems with the family history? Is there any concerns that the family has no understanding, or are there problems caused by paranoia? So let's say that way, if people are chronically paranoid or psychotic, that these will affect the family. They will be very frustrated, and that might interact with the patient's function and as well with the family's function. Right, so as I said, the full physical examination is important, and that is the whole of the body. That's the chest, the lungs, the heart, and as well as the neurology. Right, okay, so sometimes, and that's a sad thing, it's not always possible to do a physical examination if a patient is acutely psychotic and agitated, but it should also, it would be important to have a look at the patient. Does he walk properly? Does he function? Can he move his arms? Can he speak properly? So these are examinations which an experienced doctor can do without going into detail. So you can see lots of physical functions when you just pick up the patient from the ward, or you just talk a little bit with him or her, and then you can see whether the eyes are working, whether the speech is okay, whether they can move the head, the arms, and so on. Right. After this type of examination, which can be a bit more formal, but I think depends a little bit on how much the unit is functioning and working, but usually it's very important to have a thought about people having mental health or physical health problems causing psychosis. So for that, some of this stuff can't be found by physical examination, so you need blood tests. It's the electrolytes, urea electrolytes, the white blood cells, glucose, full blood count is necessary, and the liver function is important. As I said already, sometimes you need a syphilis test, because chronic syphilis also can affect the brain, and like gonorrhea can affect the brain or indirectly or directly, and then you can have psychosis. In very rare cases, you have psychosis as a first symptom of a brain tumor. So in all cases, at least once during the start of a psychotic illness, one should have a CT or MRI, and at least when there's any suspicion of abnormality in the neurological examination. Chest X-ray might be relevant if there's any breathing problems, or for the urine or UTI exclusion, especially in the elderly. The urine test is important, and sometimes it can be quite helpful also to check the urine for cannabis and stimulants. Sometimes you can, if people are quite dozy and you have, a suspicion of a different alertness, an EEG can be necessary. And sometimes it's also other examinations, like special examinations if you have a suspicion of Cushing disease, which is a dysfunction of the cortisols. So then the 24-hour collection of cortisol bloods might be important. So other other symptoms, other examinations are more or less then the consequence of a thorough physical and neurological examination. I hope this overview helps and is reasonable, and I hope you enjoy our videos, and please subscribe if you want to and can. Okay, thanks for your interest and have a nice evening.